video, I am going to first start off with reciting COIP. So the C is checking my patient's allergies and checking my physician orders. A is going to be assembling all my equipment and assessing my patient. W would be washing my hands. The I is identifying my patient, introducing myself. P, provide for privacy. E is evaluate, educate, and explain anything to my patient. So the first thing I'm going to do is I'm going to go ahead and walk into the room. I'm going to explain to the patient that the physician, Dr. Stone, has ordered for the patient to be given acetylcysteine 20% solution in 5 milliliters for a tracheal inhalation, QID, for the first dose to be given now. And I'm going to explain to my patient that acetylcysteine is for breaking up the secretions, allowing for better airway. I am also going to be performing tracheal suctioning and routine trach care. So once I have verified my physician order and I have educated my patient on that, I'm going to go ahead and make sure that my door is closed, my curtain is pulled. I'm going to introduce myself. I am the LPN student taking care of you today. I'm going to check my patient's wristband and ask him to state his name and birthday. If my patient cannot, then I can do it by picture along with ID or have a nurse verify with me. I'm going to make sure that my patient's head is somewhat elevated for the procedure to be done. Once everything is done, I'm going to go ahead and wash my hands, and I am going to listen for breath sounds, checking for moisture in the lungs. So I would listen. Once I have assessed the lung sounds, I know that I have all my equipment here. I'm going to go ahead and start to set up for the suctioning. I also have my suction ready on the wall. I've checked it, and I have the option of placing a pulse oximetry reading on my patient to check their airway status. I'm going to open this up. I am going to fill it with the saline, holding my label away while pouring. Once I have got the saline in there, I'm going to go ahead and put on my sterile gloves. I can fix this glove now. And since I am sterile, remove that. I'm going to go ahead and make sure that my patient was hyperventilated hyperoxygenated for 30 to 60 seconds. And when I am going to place this in saline to lubricate. And I'm going to hold with my dominant hand. Placing this hand is no longer sterile. I'm going to connect my suction. I'm going to remove their oxygen mask. Holding this down, I am going to place this into my trach until I meet resistance. Once I meet resistance, I'm going to provide the suction and rotating with my thumb and my first finger and letting go of this not to do longer than 15 seconds. And I would repeat this, relubricating and resuctioning as many times as necessary until my tracheostomy is clear of all secretions. When I have done that, I am going to go ahead and disconnect my suction. With my dominant hand, I'm going to remove and discard this. I would place it into a biohazard bag. I am going to now come and remove all of my trash, throwing that into biohazard bags. I'm going to go ahead and remove that. I'm going to wash my hands, place new gloves on, unsterile gloves. I'm going to go ahead and open my equipment. I am going to go ahead and remove this, dispose of this into the biohazard, remove my dirty gloves, wash my hands again, and now I'm going to do my sterile. So I would take my sterile gloves, ahead and discard that. Now that I am sterile, I'm going to remove this, keeping my field sterile. And I am going to empty all of my stuff into my sterile field. I'm now going to pour saline into this big container and one into the smaller container. I'm going to, once again, holding the label away, mix some hydrogen peroxide into that one. I am going to remove the trach, drop it in here. I'm going to let it soak. While it's soaking, I am now going to take and clean the inside and the outside of this. I'm going to dispose of that. I would not have crossed over my sterile field. I would have disposed of it. I am now going to dry the outside of this, disposing of it, not crossing my sterile field. Use my pipe cleaner to dry the inside, not contaminating and not over my sterile field. Then I will take and place this back into my patient, making sure it's secured in place. I will take this into the saline, cleaning around the trach, disposing, cleaning around the plate of it until it is clean. Once I have done that and I have my tracheostomy back in place, I can go ahead and clean up everything with the exception of these things. And I would take my and loosen that. And place the new tie in. making sure to keep it taut and no wrinkles. Explain to my patient I'm going to raise his head, making sure that there is no wrinkle. And go through and now that this is over, I'm going to reduce my confusion. Which I did get confused on the new one versus the old one. So this is the old tie. Take it off and finish securing the new tie with a easy pull. Making sure that I can place a finger underneath. Oh, gloves make everything so hard to tie. Okay, and then place my gauze under. Once I'm done, discard all of my equipment and make sure that my patient is okay. I would go ahead and document everything, making sure that my patient is in the lowest position and they have their call light in place, and document everything.